Let's go live now to Liberal Senator Sarah Henderson. Senator, thanks so much for your time. We've been reporting throughout the afternoon very long times for test results and so on in regional Victoria. What's the information that you've got in terms of the way not only COVID test results are being given back to residents, but the contact tracing? Is it happening effectively?
Well, Kieran, good afternoon. And as you know, the Commonwealth Government, led by the Prime Minister, is working very closely with the Victorian Government at what is no doubt a very, very difficult time. So our focus isn't all about how we get through this, but clearly, and I am a regional Liberal senator, clearly we have some growing challenges in regional Victoria, particularly in Colac, where there is some 50 positive cases, all mainly linked with the Colac abattoir. And we've seen today a very serious concerns raised, I have to say, about the confusion on the ground. And there is ongoing concern about the contact tracing and about the number of cases where there doesn't seem to be any known source, and that continues to be a big issue. But Kieran, I think what we have seen, the Victorian Government has now provided for a number of public health teams across regional Victoria. But I think what is now clear is that, like New South Wales, we need to have permanent public health teams in regional Victoria. At the moment, we have this centralised system, and while the likes of Bowen Health, for instance, is controlling the outbreak in Colac, it has no ostensible powers to declare, for instance, workers to be close contacts. And we've seen the confusion even today in the Premier's press conference, where it was really not clear whether there were appropriate protocols in place in relation to abattoirs. That's because workers were told they didn't need to self-isolate. They went home, they went out into the Colac community, and that it took some 2 days before they were in fact told that they did need to self-isolate. And of course, all are having a test and are being retested today. So I think that confusion would have been avoided if there had been a public health team on the ground from the minute this first case had been identified.
So basically, they wouldn't have to second guess every decision, every judgment back to Melbourne to the central department. That's the point, is it?
That's right. So the local health service, Colac Area Health, did a fabulous job being proactive, getting out there and getting everyone tested. Bowen Health was, of course, also responding, and the local community have been amazing, but they just didn't have that public health support. And as we now know, it took a couple of days before the Chief Health Officer determined that all workers are deemed to be close contacts and therefore are required to have a test and also self-isolate. That message didn't come through until 2 days after the outbreak, and that of course caused a major issue in the Colac community. And I think if we had these permanent public health teams on the ground, as is the case in other states, including of course in New South Wales, some of these issues could be avoided.
Richard Reardon, the member for Colac in the State Parliament, is saying that the state authorities, in fact the state government, should step aside and let the federal government come in and take over the testing and tracing. Is that something that you'd endorse?
Kieran, that's not our position. The Morrison federal government, of course, is working very closely with the Victorian government and providing as much support as the Victorian government requires. And we now have something like 1,400 ADF personnel in Victoria, including up to 20 ADF personnel in Colac right now, and they're testing about 800 workers from the Colac abattoir. So an incredible effort going on today to test those workers, and then of course there'll be more testing tomorrow. So we are working shoulder to shoulder with the Victorian government, and that won't change. And as the Prime Minister has said, our bill is open. Whatever Victoria needs, we are there to support them. But certainly I think if we did see these permanent public health teams set up right across regional Victoria, that would make a very big difference, and we would be able to see a much faster response and a clearer communication as to how local people should respond when there is an outbreak like this.
Liberal Senator Sarah Henderson, thanks so much for that. Appreciate it. We'll talk to you soon.
Yeah, great to talk to you, Kieran. Thanks so much.